teach. Well, thank you so much for being here on this platform,
Oh,
the
thank
Newbie Nurse
you.
platform. You don't realize how much this is going to help other nurses, especially Latino
Love
nurses.
it.
Um, I was looking through your talk. Girl, you are an angel. You have a gift for the Latino, for everybody, but for the Latino community, I could not imagine. Huh?
You're
No,
gonna
I'm
make me
telling
cry
you.
and I put makeup.
Okay. I will save the tears for later. But I'm just telling you, you're a gift, and the people of the world need you. So let's talk about your TikTok. Love it.
Mhm.
I see a lot of beauty. That's why your skin is so beautiful. I see a
No,
lot of.
you're gonna see a lot of Korean skin because I'm on it 1,000%.
I keep hearing about the Korean skincare. It's gorgeous.
Glass. Yeah, I have one of my coworkers every time that she sees me. What did you do, girl? Your skin. You know?
I'm linking your TikTok to the podcast so everyone can have glassy, beautiful skin like you. Happy Nurses Week, belated Nurses
Happy Nurses Week. I know I told my manager, I think my best gift was to be off of work. I only went like one day and I hug her and I'm like, thank you for my gift.
No mandatory meetings during Nurses Week. This is going to be a bilingual podcast, okay, guys?
Beautiful. Love
So
that.
I'm going to ask you the questions. If you want to respond in Spanish, please do. I am a emergency room nurse.
Let me tell you, it's been already 4 weeks. I have an emergency surgery. I was working through pain and it was hurting so bad to a point that I was on my patient room and I grabbed my patient and she turned into the nurse and she's like, okay, sit down right here. And she sit me on her bed. And she's like, okay, breathe through it. Breathe through it. So when I got out of work, I stopped by ED. And I'm telling you all of this because ED was crazy. And I'm like, I can't work here. I can't do this. I mean, like 4 people got up at the same time. It's like, when the doctor's gonna call me? And I'm sitting on the sofa, like working through pain. And I was with the uniforms.
It's terrible. Oh,
I got back 4 days later, I got back floor. And my manager, she's like, if I see you even doing a facial expression that you're in pain, you're back home.
as a good manager, I love that. Well, I am glad that you're okay.
My
Damn.
manager, she's like, don't even try. Don't you try to come back because you're not allowing this unit until you're fully recovered.
Now, newbies,
Yeah.
this is the kind of unit that you need to work on. This kind of supportive unit, okay? So now let's get to our questions. Well, what I was saying is that as an ER nurse, oh my God, I see that preña coming in. I'm like, oh God, don't cough, don't sneeze, don't blink, nothing. Let's go. And I work at a freestanding. So if they're 20 weeks or more, they get transferred to the main campus.
And we have our fights. Let me tell you, I have my fights with AD because every time that AD send me someone, patient showing the breath. What does it have to do with pregnancy?
Too pregnant. Yeah, I know. We're shaking sometimes.
And I have my nurses like, whatever you want me to do, she's 20 weeks. She's showing us a breath. That's your expertise.
Yeah.
My expertise is the belly. Baby's okay. It's back to you.
Oh God. Too funny. So, how long have you been a nurse? Tell me about your nursing journey.
My nursing journey. So I've been a nurse for a few years already. I did work, in healthcare total. It has been 14 years, 13,
Nice.
14 years. I was a certified medical assistant. I was a CNA. I was a nurse tech, ECT. I did it all, girl. At third floor, I lasted like for 5 minutes because I was like, this is not. I did PCU. I did step down. I don't have the brain for ICU, to be honest. One of my good friends, she actually wanted it to be a CRNA, so she needs a background on ICU. And I tell her all the time, I don't know. ICU and NICU, there are two things about me that I don't have the heart. I have the heart for everything, but I don't have the heart for neonatals and intensive care unit and ICU. Actually, while I was working on intermediate, I have to float because we have the cross train. We have the critical care background. So in my hospital, if you have critical care background, you can float to ICU. So
Wow.
once I was there and I realized that it was not for me. It lasted only a shift to realize it was not for me. But I did pretty much everything that I thought I wanted to do, besides women's service, but I circle back again to
And
women's
that's
service.
so wonderful about being a nurse is that
Yeah.
if you go here and you're like, you know what, this is not for me, boom, go to the next spot, go to the next spot. And that's another reason I wanted to do this series of different
Yeah.
nurses so they can see, that they get a little taste for each part of the hospital,
Yeah.
or even if you work from home.
If it's not for you, and if it's not for you, you can do something else. And if that something else doesn't work, I mean, the beauty of nursing is that you can try. And if you already get tired of what you do and you want some excitement in your life,
Yeah.
you can find and you can be in nursing. That's the beauty. You can do whatever you can do, even though me working on women's service, mira, yo hice gynecology, oncology. I was in maternal fetal medicine. I did high risk OB. When I graduated from nursing, I worked for a company that they have a lot of gynecologists obstetrical office, and one of them they needed a clinical lead supervisor, and it was the perfect job for someone who wanted it to be in an office, who wanted it to have their own space. I'm a people person. I like to talk. Being in that office, I was driving crazy. Mi esposo le decía, vamos a hablar porque es que yo no tengo aquí con quién hablar, yo quiero hablar con alguien.
Yes. Yes.
And I used to see patients like one or twice a week because everything was like behind the computer. I was the one who was checking labs, doing a lot of education, seeing pregnant patients, talking to them and educate them about results and all of that. After 6 months, I say, this is not for me. I'm sorry. And when I said, I'm sorry, but I'm gonna move. I was actually trying to move to Miami. That's the other thing. Like I'm the gypsy of my family because I move everywhere, and they call me and my husband the gypsies because yeah. I mean, it is what it is.
The freedom that is a gift. I love
Yeah.
that.
And I want to tell you something because if I don't say it, it's in my chest. So I went to your page and I was trying to look like where do I see the podcast.
Yeah.
And when I saw you went to Jen
Oh my
Hamilton,
God. Yes. Did you? Yes.
I almost had a headache. I almost right there, I was like, she was able to go. When
Yes.
I checked, it was sold out. So I
Yes.
couldn't.
It was sold out like that. It was gone.
She's my God.
Bro,
She's the God for my unit.
my God. It was so good. I'm sorry to rub it in, but I was like, wow.
Yeah.
That place was packed, 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 packed.
She's
Loved
the
it.
God. She's the God of that unit, let me tell you.
And also, she's so nice. Like,
That's her. She's
authentic. That
authentic.
is the
She's
word.
authentic.
She's
She's
so fun,
authentic.
authentic. And what's crazy is, you know, she had posted, I guess, when everything started working out with the book and she had to take a little break. I was like, wow, this poor woman put her heart and soul into this. And then now I felt like she was kind of a little scared. Like, whoa,
Yeah,
I
because
don't want to give it away because at the show, the Q&A, she talks about it, but what a gift she is, and
yeah.
you got to get the book. She has the audiobook and the book. So
I'm dying to get the audiobook because let me tell you, if I want to be someone Latino wise, Spanish speaking, it will be a Latino Jane Hamilton, the Latino version, the Venezuelan version of it.
we need it. We need it.
Yeah.
It took my dad, he passed away a couple years ago, but I remember being in the hospital with him and a phlebotomist came in very sweet. I don't even know how we got on the subject. Maybe I had my scrubs on because I came after work to see my dad. And she was like, I want to become a nurse, but I'm scared because, my English isn't that good. I said, girl, do not let that stop you. You don't know how many people are at the bedside right now that speak
Yes.
less English than you. Please don't let that stop you.
And
Please.
that's what I tell everyone. That's what I tell everyone. And I try to say it as much. I even share on one of my posts. I even share when I got into my unit. And right now has been much better. But at the beginning, they even act like they didn't even understand me what I was saying. And it was a lot. And if my manager would be here, she would say, type of person that everybody tells me how you can tell me, oh, you're great, you're this, you're that, you're an angel, but I don't believe that in myself. I'm just me. And I give you what I have. And if I see, like, I have a patient where she didn't speak English. So it was a lot of going on. She lost her baby. Y era ella sola nada más, porque su esposo estaba cuidando a sus hijos. No tenía familia aquí. So, and she was doing all of that by herself. I don't see myself doing nothing else than just being her for her and support her. And that was one of my videos that I did a few days ago that I said, yeah, I know we all have our issues. We all have life. We all have family. We all have kids. But remember, nursing is a calling. You really need to feel nursing in you because you work with and what you provide. You don't know how much you can provide to someone. And to be honest, the way that I do nursing, I care if you're my patient, you're my sister, and that's my nephew. That's my niece. That's a baby that it's, and I was working on Mother's Day and I told my patient, you are about to give me my Mother's Day gift because this is my Mother's Day gift. And I need you to have baby today because that's my gift. And I'm fighting for my gift. Night shift, I'm not going to give it to night shift. You and I, we're going to do this together. And actually, she did. She had the baby like at 5 something. And I was like, yes. I cry with them. It's very rewarding. But at the same time, I don't believe in myself. I have that issue about me. I never believe that I'm doing something or if I'm doing it good or because labor and delivery is very complex. Labor and delivery, and one of the biggest things that I tell el que quiera entrar a labor and delivery is that you gotta be patient with yourself because it's a lot. It's a lot to learn. It's a lot. It's complex, and labor and delivery can switch from 0 to 100 in a second. You can be talking with your patient right now, laughing, watching the strip, and 2 seconds later, you're rolling her to OR. And it's hard. And especially, I don't know why now why C-sections are like, hay tanta mala información about it. And I want to bring awareness to it that I have patients that they want to go natural. They don't want to use epidurals because this and that, because social media, a lot of misinformation. And at the end, it's okay. I tell my patients, this is not about me. This is not about the hospital. This is not about the doctors. This is about you. Yes. You are in charge. And I stole something from Jan Hamilton that I tell all of my patients. I say to my Spanish people, I tell them, yo solamente soy el parlante que va a spread your words and your wishes out to the floor.
Wow.
I'm here to speak for you. I'm here that has the power to go back and say, this is what she wants. And believe me, I'm going to support you. And if you don't want to push on your back, guess what? We're going to put that butt in the air and if you want to push squatting, if you want everybody to see your butt, that's okay. If you want to push it like that, we're just going to push like that. And I will cover your butt. That's okay. If you don't want to be on your back, if you want to push with music, if you want to pray, we're going to be praying 1, 2, 3, and we're going to be praying and push. And I love what I do. I love what I do.
For sure. For sure.
I tell everyone that comes to me, and I tell them this is a moment for you to remember the rest of your life. So I'm here to make it special. That it for you and your baby. We're gonna make it special. We're gonna, and if in case of things go wrong, or if in case that I can see that something that you were not expecting is coming, it's okay. It doesn't have to be perfect. If we have to twist and change the things, at the end, what we need is to have a healthy mom, healthy baby. That's what we need. And that labor and delivery, I feel it's has been a unit that has changed me for sure. It have proved me that nursing is my calling, to be completely honest. Now I have my days where I quit.
He does. Yeah. I'm done. I'm just gonna be like a dishwasher. I would be happy washing dishes.
I'm a mechanic. My manager knows if I change career, I'm a
Yeah.
mechanic. If you need a car service, I got you. Because
All
my
right.
mechanic charged me $800, $900 every time that I have something wrong with my car. So that's perfect for me.
Yes.
And
Yeah.
she laughed. I tell her like all the time, like I'm switching career. I'm
Or
a
like
mechanic now.
the person that waters the plants at Lowe's. They're so chill. I love that. For the last shift, I feel like out of the 3 shifts, there's always one that's really crazy.
In labor and delivery, you can have the perfect shift, but let me tell you, I shift where it is my first 1 out of 3, and I'm already quitting. Like 45 minutes later that I clock in, I'm
Yeah.
quitting because I have a baby that I have nurses where they're giving me report and they're like, baby has been wonderful. Mom is great. Everything's go
They clock
beautiful.
out.
She's on 18 up it. They clock out. And then when I open, what happened? It's me. So one of my attendings, we're funny because every time that she's the attendant and I'm in,
Yeah.
and I tell him, it's like, dude, are you the dark cloud or it's me? We gotta figure if it's you, me, or
It's a
working
hurricane.
together.
Do you guys have superstitions? I've heard like and
Yeah. We
about like
don't,
when
yeah.
it rains, like the kids.
Yeah. I mean, so full moon, it's
Yeah.
the same for you guys. It will be the same for us. Full moon for us, we will have we'll have, I don't know, a hemorrhage. We'll have, I don't know, something will happen. But we never say it's quiet.
But yeah.
Never.
Never.
Because you
Never.
triage in 0.5 seconds, you will have a whole unit. Yes. Yeah, we do. Also, we don't say there's no antes. Like it's like antepartums. Patients that are not ready to have a baby, but they need some. Like we don't say that because 45 minutes later, you will have 15 of
Yes.
them.
Yeah,
Blood
the
pressure
ED,
issue,
ED's wheeling them up.
diabetes, preterms. You will have it all. So every time that our unit is like, we just have one patient in labor, or when we have just only 2 patients in labor, my unit is 15 labor rooms, right? So when you have 2 of them, you shut your mouth and you just pray that stays like that. Got it.
For real, it's the same way with us. But have you heard the raining one? Like, I've heard that one, like, when it rains, like, or hurricanes, like, there's a lot of babies that get born. So
Well, no with the rain, but definitely we have our month. Valentine's Day, we already know that we're like our busy times, it's always August, September, October,
I didn't know
definitely
that.
November. Yeah,
Okay.
because of course, our unit's very, very unpredictable. There's no, you can't really know if you're going to have like, because I have come to my unit where we have only 1 patient laboring, and cuando me voy, los 15 cuartos, they're full.
Yeah.
So, yeah. So when they come to triage, And drive-bys, they scare me. Oh, because drive-bys, they always come with the head of the baby halfway out.
Wait.
So
What are drive-bys? What is that?
drive-by is a someone that just come laboring that you have never seen, and the head is crowning.
Yes, yes. When I
So
did my rotation in L&D, when I first started working at the facility I work at, I was like, oh yeah, because there was a patient that came in. They drove by, they saw the hospital sign, they came in. I heard they delivered a baby where I work at, and the L&D nurses said, "Nah, y'all ain't delivered that baby. That baby delivered itself."
I have one. I never gonna forget about her because she's actually a multi. So you know trust a multi. That's another thing. You never trust a multi.
Yes,
They's
yeah.
gonna sneeze that baby out. I'm telling you, these patients, she laughed the baby out. So
Wow,
she was,
that's the
so
big.
she came because she had some pressure, right? When she came, she was 6 centimeters when she came. So I did her admission, whatever. And that day was like super busy. My tech, she was in the OR. So I was like, okay, she's 6 centimeter. Just check her. She's 6 centimeter. Let me go ahead and do my table. So we have a table. What we said, that's the table that we actually grab when we're going to deliver. So I was setting my table and the husband's super quiet, super cute. He came to me and he's like, she says she has some pressure. And I'm like, okay. But in my mind, I'm like, I just checked her. She's 6 centimeter. Let me finish my table. So I'm opening my thing like, ah. 1 minute later, he came like, she says that she needs to poop. And I'm like, but in my mind, I still have that.
Yeah.
So I put my glove on and something in me, I was like, let me just left the blanket. So I was like, damn it, team.
Oh my
So I
God.
wait, it gets better. I tell the husband, the car was detached. So he was present. He was like, I ran to the door. I opened the door and I'm like, oh, she saw me and she started laughing. She just pushed the baby out. I mean, she literally gave 2 seconds. And I told her, I already have your face and your name in my database.
Yeah,
When you come next year pregnant,
God.
I'm not going to be here. I'm
Yeah,
not going to be your
get
nurse.
on the list.
You're on the list. Yeah, you didn't give me time to prep. And she was amazing. Yeah,
Oh.
I mean, things can change quick, very
Yeah.
quick.
So for all the newbies, let's say they're in nursing school right now. There is sometimes they say that you can't go straight into a specialty. Do you find that your unit actually hires new nurses, like fresh nurses?
Actually, yes. Yes, they do. And that's beautiful. I support that 1,000%. We actually have two new nurses, brand new. Both they And one of the biggest thing that I will tell new nurses is, first of all, if you apply to this hospital and they tell you no because you're new, find another hospital and keep applying. Just keep applying. Let me tell you something, and I tell everybody this. Grab your resume, put your uniform, go to the unit, knock at the door, and say, I am Mercedes. I'm a new grad, and my dream is to be a labor and delivery nurse. That never fails. That never fails.
That is
Don't go,
golden.
don't go, don't let a computer tell you this is not your chance. Don't let that. If you apply and you receive, I'm sorry, right now you're not the candidate. No. You haven't given me the opportunity to tell you who I am. And if you truly love, and if you truly, it's something that you truly want to do, and if that doesn't work, that doesn't mean you're not going to be a labor and delivery nurse. That means you need to learn something in order to get into that unit. So no te dejes caer, because I'm going to tell you my story. So I worked maternal fetal medicine for 13 years, right? So I was working on and step down ICU, and I was I was working in there, but it was not my jam. I was not happy, even though that I gave my 100% on every shift. It was not what I wanted. So labor and delivery was actually the final spot that I needed to complete women's service. Because I work with premenopause, postmenopause. I work with patients in maternal fetal medicine. I work regular gynecology. So I work everything. And labor and delivery was the last spot I needed to complete the whole umbrella of women's service. So I was like, okay, I wanted to learn labor and delivery. I wanted to do labor and delivery. So I have one of my good friends. She works in NICU. And in my hospital, we are the pink tower. So the pink tower, it's where NICU, labor and delivery, triage, it's where everything women's service is the only tower for women's service. So I went to my manager. I was working on PCU, and I knew that my manager name was this one. So I was like, okay, I need to find her. I need to talk to her. I need to talk to her because I wanted it to be in this unit. So everybody was telling me, oh my God, no, your unit, oh, it's so hard to get in.
Wow.
So yeah, I mean, my people, they're being there years and years and years and years. So I found my manager and I'm like, okay, I have this many years experience in women's service. I have experience on maternal fetal medicine. I have. And she was like, okay, let me interview you with the manager, like the whole building manager.
Wow.
She was in charge of the whole building. Okay.
Yeah.
Someone who's been around for many years, many experience.
Yeah.
So when I met her, she was like, labor and delivery is a very hard, very complicated. It's a unit that it's not for everybody. And just because you're being many years working in women's service, this doesn't tell me anything. Tell me about you. I wanna know who you are. So I was talking to her, but when I finished the interview, I came out bawling. The next day, I got the call. Welcome to labor and delivery.
So happy. Girl.
I cry like a baby. And I've been crying since then.
Look, I'm sure they're
Because
happy to have you because you're amazing.
even though, and I'm telling you all of these because to my new people, even though coming from someone who has experience, I'm learning every day. I cried every day. I feel like I'm not enough every day because it's hard. Labor and delivery is hard, but you got to give yourself a time because everything is about time. Learning is about time. And now that I've been working in my unit with time, I always asking for questions. I always asking for help. I'm always like, am I doing something good? I'm doing like I'm missing a step or like I'm always worried. And all it's because you want to do good for your patient. You want to have your patient safe and you want to give it everything to your patient. And it will be a little overwhelmed if you come fresh from school because you have to learn a lot of things. I mean, you have to learn the hospital world. It's a completely different world.
Exactly.
And you have to learn new system and also you have to learn your specialty. And you're learning how to be a nurse, how to think as a nurse, how to talk as a nurse. So it's a lot. So give yourself a grace.
So
It's something that is going to take time and you're never going to feel comfortable on your nursing shoes. Because the day that you feel comfortable in your nursing shoes, I will be concerned. Because you will see new things all the time. And you working on ED, I don't know if that's the case, but I'm always
no, it is
learning
the case. You do
something new.
You do get a sense of confidence, but you always have to have your head on a swivel. Like, become complacent. Don't be like, oh, just let the
I know
alarm.
this. I already know this.
Yes.
It's
Yes.
not because that's the moment where something completely new that you have never
Exactly.
seen in your life.
Yep.
And you're not gonna know what to do.
Yep. That is 1000% true. So, the last question that I have for you is if you could change one thing in the nursing world, anything, without any red tape, without you have excess amount of money, what would you change? First thing that comes to your head.
I already have it in my mind. I don't know how to say it in
No, please
English.
say it in Spanish, please. Please.
Sometimes we forget how does it feel being new.
Yes.
And being an nurse with experience, I feel we're not passing on experience. So we're not, when our abuelita tenía en el libro de receta, and
Yes.
she got all the recipe, and that book she passed it on to your mom, and your mom passed it on to you, and you pass it on to your kids. I will change. I don't know where and at what point of nursing we're passing on experience stuff.
Yeah. It's
All
so true.
nurses, I don't know when nurses got tired of giving and share that information, that experience, that I don't know. And I will change that. I will tell all nurses, share with new nurses your the way you do things. Because today I have a case where we have to do a surgery in a different OR that it was not our unit OR, right? So I was the new kid in that block. I was the new kid in that environment. So I was in the OR with the things that I wanted. They knew the case, but looks like they didn't realize it. The case was there was a angel inside the uterus.
Mm.
And they were like, so I came with myself the things that I needed, right? Because I was acting as the baby catcher, right? Or the angel catcher in this situation. So I came to the OR and I was in the OR and everybody was like, and you are and who you are and okay. So I'm like, no, I'm receiving for labor and delivery. Oh, why? There's a baby there that I needed to take and I gotta go back with it. And they're like, okay, so and every time that somebody knew that they all knew each other, but I was the new face, right? So and they were like, oh, and who you are and who you are. And that vibe. Don't like why you needed to get that vibe.
Yes.
Like welcome me. Welcome. Be welcome. Be warm. Be like, I know you're tired. I know it is the end of the day. I know probably you don't want to be there. I know you want to be with your kids, but that vibe. So when like the surgery started and all of that and my part came, when they realized that she lost her baby. And here you are to grab a baby. And it was little thingy like this. And everybody was tapping on my shoulder like, how do you do this? And I do it because I have first of all, is a human, is a mom. It's somebody who's there who needed a surgery, but poor lady, she went through a lot. And the reason why I'm here because I'm the person in charge to take care of the little thing that I have to preserve because when she wake up, the first thing that she's gonna ask is, where's my baby? So when they realized that it was not a typical case, and one of them looked at me and said, and this is your everyday, right? This is how your every shift looks like. And I tell her a good 60% of shift, this is what it looks like. And like, it's not colors and rainbows. So the vibe changed completely.
Wow.
When that moment hit and they all realized what was going on, the vibe completely changed. But again, just be mindful. And that's something that I will change. But just think what you do as a nurse. Just think And when there is new nurses, we need them to learn, no matter how hard is or how bad is your day going or how hard. Everything is about who you're serving and who you're taking care of.
Yes, because in the end,
I would change that.
that's beautiful. That's amazing because in the end, all I believe that we all became nurses because we wanted to help people. And when you said, I don't know what changed about teaching, I mean, for some reason, social media pops in my head, even though we're doing social media. But I feel like the perception of the nurse is like, oh, I'm going to have this bag and this cup and this stethoscope and these scrubs. And it's like, what you really need is your hearts and your minds, and the willing to want to do this. Yes, you look cute, but can you save a life? You know?
Exactly. Can,
Can
can
you
you can you think can you think through tough moments? And that's what I'm gonna tell you that I wish I can make videos that I can romantizar. You know those videos like girl, like hey, come on a date with
and we
me.
can actually.
I made a video 2 days ago. One of the reasons why it's not the only reason, but one of the biggest reasons that I work like I love my unit is you can come in pajama
Yes.
and without brushing your hair and nothing because you just get up, like wash and shower and let's go and do it.
These scrub caps are amazing. I love them. My hair is
I
so curly.
love it.
Let me tell
I
you.
was actually about to ask you where did you got it because I love
I'll
the
send you
combination with the cap and the
on
glasses.
Amazon. On Amazon, I'll send you the link, and then you can do your thing with your.
I love it. But you know what? I think you're right. Maybe social media and romantizar all of those videos that like show or kind of like show the world what we do is just being cute and grabbing a cup. I wish that we all can share like freely because HIPAA and hospitals
I
and
Yeah,
you really got to be careful what you said. But I wish we can speak freely of what we real do, like real life, what it means to be 12 hours with real
yes.
talk. I got a
People do
patient like
not
this,
realize.
this, this, this.
They do not realize.
Change that will change completely the perspective of what we do as a nurse.
With that, The Pit. I have not watched The Pit because I watched the previews and it gave me
Having watched,
anxiety, and I'm like, oh no, I feel like I'm at work. So that's a good thing, I guess. That means that it's a good show. But, my brother, he calls me. He's like, oh my god, he's not in healthcare. He's like, you guys go through this shit. You guys, people hit you. People do this. Like, it's showing the world. Like, yes, we go through abuse, and especially in L&D, I hear there's a high rate of like violence.
one of the biggest things that that I have to work through it. I'm working on my every shift. I'm working through it. Is that you will have patients where they will be laboring, crying in tears. They will be, in pain, and they will have partners that they just will be in front of the TV playing. That's
That's a prereq of your life you're gonna have. Like, you're gonna be with your baby, and he's gonna be over there.
let's say
Wow, that's wild.
you have to control yourself as a nurse.
Yeah.
I actually have to. I told my charge. I I I grabbed her shoulder. She looked at me and she said, "Go ahead." I said, "I'll be right back. I'm going to the bathroom." She saw my face that I was about to kaboom. And as a nurse, you can't do anything about that. I mean, you can, but it's sometimes you have situations where you have to control yeah, like you have to bite your tongue to the point where your tongue is about to bleed. That's how hard you're biting then. Not to talk, not to say anything. But yeah, I mean,
Wow.
there are situations where you like when you have abusers, when
Mm.
has been your patients is being abused and they're there and you have controllers, you have that they don't even know what the is an epidural, but they're saying, no, you're not going to give an epidural to my wife. And
Wow.
poor ladies crying in tears in pain.
Yeah.
And they're telling you, No, who the are you?
Yeah.
You
No.
don't even know what she's feeling. You don't even know what's an epidural. You know what's epidural? Yeah, something for pain. Oh,
And I think that's a big misconception about L&D. Like some people look at like other nurses like, oh, it's all like you said, unicorns and rainbows and it's so happy and blah blah blah. And it's like, well, you don't realize all the
I made a video not long ago explaining everybody because I don't know why people think we spend time with baby. We don't spend time, we don't cuddle with baby. If you're lucky enough, you see baby when he burns and it's on mommy doing chest to chest. That's your lucky moment where you're gonna see that baby, you're gonna see that baby again. You're not gonna hold that baby again. Because you're like labor and delivery, it's all about mom and fetus. When it is inside baby, when it is inside mom. But once the baby's out, guess what? It's about mom. Still about mom. Because she's going to be 2 hours with you in recovery. So all you eyes, ears, and instinct, it has to be on mom. So people think that, oh my God, you hold baby all the time. No, I don't.
no.
I don't. I don't hold babies. I know how to make burritos. I make really cute burritos. I will fold them very cutely with
Yeah.
with a blanket.
Well, Mercy, thank you so much for your time, for
Thank
your
you.
experience. It's an honor to
Thank you.
meet you. And I will definitely, I'm just so grateful to have met you.
It has been, and let me tell you, the reason why when I read your post that, hey, you want to share your story, is that we need more people like you. More, we need more people to do content as let me show you what I do and let me show you what all of my peeps and my colleagues. And
Yes.
I think you're doing such a great job allowing us to speak freely and share what we do, what we think, and all the specialties. So I'm honored. Thank you for allowing me express myself and tell who I am and tell my stories and thank you so much. Thank you because it really means for me. As my mom, I've been excited since you tell me, girl, let's do this. I've been very excited, okay? I think like Helen Show is doing the interview.
Thank you so much. Mercy, before I forget, you really think about doing your own podcast. I'm telling you, you have the energy, you have the hook, you have everything. You should think about
I
it.
thought about it, but I don't have time.
So if you ever thought about doing something like that,
I always that this is something that I always wanted, but and you know what? My TikTok is the fourth of the fifth time that I used to have a TikTok that I got more followers. And one day when I realized it, how many people were like looking at my videos, I got a panic attack and I closed it. Out of
yeah.
the nowhere. Out of the
No, I
nowhere.
understand. Yeah, yeah. It's fear of change. And
Yeah.
but now once you get to that point again, you're not gonna do that. You're gonna just keep going. Keep going.
I
Because it's
just
always
yeah.
gonna be
And I just told my husband that. I said, this time I'm not going to be afraid
yes.
because this is something that I wanted to do. And it, once again, God is giving me the opportunity to do it. And for people being interested of what I say and being interested of who I am, this time I'm not going to be scared of it. So yeah,
We're gonna keep
I'm a big girl now.
well, yes, you are. We're gonna keep cheering each other on, and I can't wait to see
Yeah.
how we are this time next year. Okay?
Oh,
Thank you,
absolutely.
Mercy. God bless you. Have a great
God
shift.
bless you, my love.
Bye. Nice to meet
Bye.
you. Bye-bye.